If your child needs surgery, you want to make sure the hospital you choose is experienced, but information on how often many procedures are done on children is often shielded from public view, leaving parents in the dark.
Investigative reporter Joce Sterman discovers why and talks with a nonprofit trying to go behind the curtain of children's hospitals to learn more about the facilities we trust.
Look how beautiful it is this morning.
On this escape to paradise, Juliet Pace could just be a kid, not a care in the world, untethered from life's challenges. But at home, reality can be far less fun to capture.
Seeing your child just in a hospital for anything, automatically spikes my anxiety.
Bethany Pace has felt it many times. Her daughter, now a teenager, has sickle cell disease. For years, the family has trusted Johns Hopkins Hospital in Baltimore with her care. A big reason, Bethany says, open communication, and not just from the doctors, but by the hospital posting safety data on its website, in public surveys, and by giving Bethany a voice on a patient and family council.
When there is that transparency, they're saying we are taking accountability for the care that we provide.
But when it comes to care for children, there's something even the most transparent hospitals don't typically share: data about pediatric surgical volume, how often certain procedures are performed. Our national investigative team discovered there's virtually no public information available about pediatric volume at specific hospitals, even though similar information is widely known about adult patients.
For the most part, parents are making blind decisions with their lives of their child.
Dr. Peter Pronovost with University Hospitals in Cleveland, a leading healthcare quality expert, says the data that could inform their decisions does exist, but isn't publicly shared.
Every state has an all-payer database that counts surgeries, and the Agency for Healthcare Research and Quality has that data. They purchased it from the states. But the data use agreements between the state and AHRQ precludes them from making this data public.
Those agreements relate to the Kids Inpatient Database put together by the AHRQ, the agency Pronovost mentioned. It has data from millions of pediatric hospital patients, including procedure stats, but it's kept totally confidential. We repeatedly contacted AHRQ asking why it continues to shield this information from public view. The agency didn't respond to those questions. We also repeatedly asked the Children's Hospital Association, which represents more than 200 pediatric hospitals, to talk with us. It declined. An organization called Leapfrog is trying to help parents see behind the curtain of children's hospitals. The nonprofit collects voluntary surveys from facilities coast to coast, gathering data on safety and quality. But more than 2/3 of pediatric hospitals surveyed declined to respond.
As a parent, I will go to the end of the earth to find the right hospital for a child who needs critical care. And yet, very little is available to me to choose among those hospitals.
Our team canvassed dozens of children's hospitals from coast to coast. We repeatedly heard that while transparency is a priority, limited resources make responding to Leapfrog challenging. Many told us they voluntarily report data to registries that track specific conditions or surgeries and supply information to state agencies or medical associations. Some told us they have questions about Leapfrog's methodology and prefer to participate in the survey from U.S. News and World Report.
And I would just wish that everybody's equal and that we can all get the same information.
The Children's Hospital Association says healthcare decisions are best made between families and their doctors, and that its members follow data protection laws to protect patient safety and privacy. Experts tell us parents should ask surgeons and hospitals directly how often they've done pediatric surgeries to make sure they feel comfortable.